Hello friends, myself Dr. Rashmin Cecil, pediatrician at Hillel Children Hospital. Today I am going to talk about ORS Day. ORS means Oral Rehydration Salts. ORS Day is celebrated on 29th of July every year to highlight the importance of ORS in therapy of diarrheal dehydration. World ORS Day. Why ORS Day is celebrated on 29th July? Month of July heralds with the beginning of monsoon and ushers in deadly disease of diarrhea and vomiting. On this day, we also remember Dr. Dilip Mahalanobis, an Indian scientist who was a member of a medical team during cholera epidemic. He is the pioneer of using ORS as a medical therapy in Calcutta. About Dr. Dilip Mahalanobis, born on 12th November 1932, Director of International Center for Diarrheal Disease Research in Bangladesh. During cholera epidemic in 1971, Dr. Dilip left a research group and went to a refugee camp. From 1975 to 1979, he worked in cholera control for WHO in Afghanistan, Egypt, and Yemen. He worked as a WHO consultant on a research on the management of bacterial diseases in 1980. Cholera epidemic in 1971 in Bangladesh. During cholera epidemic in 1971, Dr. Dilip and his team moved Bangladesh to serve in the refugees camps located there. When they reached there, they were taken aback by the pathetic situation they had witnessed there. There were two rooms in the hospital that were filled with severely ill cholera patients lying on the floor in their destitutes. In order to treat these people with intravenous saline, they literally had to kneel down in feces and their vomitus. How did they find a solution? Within 48 hours of arriving there, Dr. Dilip realized that they were losing the battle because there was not enough IV fluids and only two members of his team were trained to give IV fluids. He didn't had privilege to consult knowledgeable people or skilled people at that time to help them, so he had to make a quick decision on his own before the condition of patients get worse. He decided to give oral rehydration therapy by glucose solution bottles to patients by mouth and explained the team to prepare a solution for oral rehydration therapy. And they found amazing results of oral rehydration therapy. It was their innovation, an innovative idea they have implemented. If it didn't work, they would have no options. It was a huge relief when they saw that it really did work. The sick people who were lying on the floor and that could barely crawl were able to sit and speak after oral rehydration therapy. It was very easy to provide ORT to the infected people, and as the patients got better, once infected, served as a volunteer and helped the doctors of the team to reach out to the needy patients. How it was benefited? Within some days, they realized that it really worked, and it was a suitable method of curing dehydration which does not require any sort of training. At that time, they coined the term oral saline. They did not know that ORT would become one of the most successful treatment for dehydration. They prepared literature in pamphlets form describing how to mix salt and glucose and distributed people along the border. The information was also gained popularity and was broadcast on a Bangladeshi radio station. Oral rehydration salts. After 1970s, WHO and UNICEF adopted ORT for management of diarrhea and dehydration in children. After 1990, ORT became more popular and available by the efforts of WHO and UNICEF. The impact of ORS. The global statistics of death due to diarrhea in children under 5 years of age has shown steady decrease. Number of hospitalizations and duration of hospitalization also decreased. Significant decline in the expenditure of IV fluids, IV sets, and their therapy. Let's look at the clinical cascade of diarrhea. What happens to children after getting diarrhea? Initially, they become thirsty and slightly irritable. Then, gradually, as diarrhea progresses, they become more irritable and have pinched look. As the disease progresses, they got depressed fontanelles, sunken eyes, dry mucosa, and decreased urine output. Then the progression tends towards abdominal distension because of potassium loss in diarrhea. Then they develop deep and rapid breathing, we know as Kussmaul breathing or acidotic breathing due to bicarbonate loss in diarrhea. And then ultimately leads to weak and thready pulse, decreased blood pressure, that is hypotension, and marked oliguria, and ultimately death. And because of its mortality in diarrhea due to dehydration, and the cure of dehydration lies in oral rehydration salt solution preparations given to patients, it has gained wide popularity. There are many signs and symptoms for assessment of dehydration mentioned here. Management of diarrheal patients include rehydration by oral rehydration therapy, continued feeds, especially if child is breastfed, continue breastfeeding. Important micronutrients is zinc to be given for 14 days, and prevention by clean and improved sanitary facilities. Indian Academy of Pediatrics has also developed various themes according to popularize the importance of ORS. In 2017, the theme was ORS, the only rational solution. In 2018, the theme was ORS all the day keeps dehydration at the bay. In last year, 2019, the theme of IAP for ORS Day was it is Amrit in Dehydration. What is ORS? It is a combination of 3 salts and glucose. And after dissolving ORS, that is oral rehydration salt, which is in a powder form, we dissolve in water and the liquid becomes a solution, that is ORS solution, has sodium 90 milliequivalent per liter, potassium 20 milliequivalent per liter, chloride 80 milliequivalent per liter, and citrate 10 milliequivalent per liter. In initial years after launching of ORS, it was bicarbonate and later on replaced by citrate, because there were many advantages of citrate over bicarbonate, like citrate has increased shelf life, it has better taste, and there are unsoiled packets. Basic principles of action of ORS. Sodium and glucose coupled transport stimulates water absorption in gut. Maximum uptake of sodium and water occurs when sodium glucose ratio is near to 1:1. This mechanism remains intact in all diarrheal patients. Utilizing this principle, ORS works. In what proportion ORS may be given? In general, ORS solution is to be given in moderate dehydration case 75 ml per kg over 4 hours, and then reassess for the status of hydration. The maintenance dose of ORS is 50 to 100 ml per kg in 24 hours after correction of dehydration. And for ongoing losses correction, after every passage of stool, 10 ml per kg of this ORS solution should be given. How to prepare ORS solution? This is very important because doctors prescribe ORS, pharmacists or nursing staff explain, but ultimately it has to be prepared by father, mother, or other caretakers. There are two types of sachets commonly available. Is one is meant for 200 ml of water, and another is for 1 liter of water. So one sachet is to be poured in appropriate amount of water. Stir it properly to form homogeneous solution. Keep the container clean and closed, and utilize it within 24 hours. And if it is remained, please discard. And boiled or cooled water is preferable, but one should start ORT by ORS solution to be prepared in any potable water which is clean and used household. How to give ORS? Very important instruction to be given is ORS is to be given by sip, that is like we drink tea or coffee. It is preferable to give with spoon, because with spoon sip by sip method can be incorporated easily. Don't give in gulps, because it leads to sudden passage of stool because of gastrocolic reflex and sometimes vomiting. And if vomiting is there, hold for 10 minutes and restart ORS solution. Limitations of ORS. Like every good thing has advantages and limitations also. So with ORS, it does not decrease the volume of diarrhea, it does not stop diarrhea, it does not decrease the frequency of diarrhea, and it does not decrease the severity of diarrhea. There are reasons for underutilizations of ORS, like poor acceptance by parents and other family members. Taste is moderate or okay, so acceptance is poor. Vomiting is one more limiting factor, because all gastroenteritis cases may have few or more vomiting. Absence of change in diarrhea, because after giving ORS solution there is no direct effect on diarrhea, but it corrects dehydration. And ignorance about the importance of ORS. And that is why ORS Day is celebrated on 29th July every year, to spread the awareness about ORS and awareness about its importance. In Gujarat and in India, we know that many times in interior places ORS is not available, or one cannot give ORS because of the reasons mentioned. There are home available fluids also, like dal water, buttermilk, coconut water, rice kanji, fruit juices, and salt sugar solutions, which can be given. There are improved forms of ORS, like low osmolality ORS, where sodium content has reduced to prevent toxicity of sodium. Super ORS, that is cereal based or rice based ORS. And Espegan, it is a European Society for Pediatric Gastroenterology recommended ORS. In India, we know that 80% of population is residing in villages which are interior, and some reside in very interior most part of the district or the region, where in diarrheal patients or children, ORS packets are not easily available. So till they get the ORS packets or sachet, they should start sugar salt solution. And here this picture depicts the importance of how to prepare it. 500 ml of water is to be taken, which approximately 2 glasses. A fistful of sugar is to be added, and a pinchful of salt, that is to be added in that 500 ml of water, and we should start giving to the children of diarrhea till we get ORS packet. To spread the importance and awareness of ORS, whole world celebrates ORS week in between 25th July to 31st July. Thank you very much. So friends, after understanding the importance of ORS and oral rehydration therapy in combating dehydration by diarrheal diseases and in saving lives, especially of under 5 years of aged children across world, let us spread its importance on this ORS Day, and let us celebrate this ORS week from 25th July to 31st July. Thank you for watching this video. If you like, please subscribe. Signing off, Dr. Rashmin Cecil.